Welcome back in. A new study has found a significant rise in the number of caffeine-related emergency room visits, but among kids. According to a new study, caffeine-related ER visits nearly doubled for middle school and high school age children. This is between 2017 and 2023. So here to talk about what might be leading to these visits and what you should know about the health risks of too much caffeine is Dr. Shireen Banerjee. This is Director of Denver Health's Rocky Mountain Poison Center. Thank you so much for being here.
Thanks for having me.
This is such an important topic. We were just talking about it. Certainly an alarming trend, one we don't want to see. How much of this conversation is focused around consumption of energy drinks and the ages of kids?
It's very, very popular because these are very readily available. You can go to gas stations, you can go to drugstores, grocery stores. So the conversation is that just because it's available doesn't mean you should let your child buy them.
Yeah, and they're available, so kids are getting them. Are you seeing a lot of calls into the Poison Control Center about these energy drinks?
You know, from 2019 to 2023, we saw a pretty significant increase. So we went from 28 cases in 19 to 55 in 2023. So that's a pretty significant rise. The age groups we saw the largest rise in was from that 6 to 12 as well as the teenager group.
6 years old?
Wow.
Yeah. That's really young. Do you think it has to do with access to these drinks or maybe marketing?
I think both.
Okay.
Heavily both, because my 13-year-old knows well about them and they talk about it at school. So I think they're very easily accessible, but they're also being talked about as being cool to drink.
Yeah, and it has a lot to do with the marketing. Can we talk about symptoms? What do parents need to look out for when it's just gone over the top and they need help?
Yeah, well, the good thing is that caffeine is very readily identifiable. You're not asymptomatic. So either nausea, vomiting, headache, you're feeling like your heart's palpitating, beating too fast, shaking. So there's a very recognizable. Parents just need to know that. What's going on with my child? Could it be all the caffeine that he's drinking?
Is there a time where you should seek medical attention?
Absolutely. So with all things, if too much caffeine is happening, then the person is at risk for seizures, effects to their heart, lots of vomiting. So for any of those symptoms that are persistent or severe, they need to go to an emergency department.
Can you talk about, do the amount of caffeine and symptoms differ from children to adults?
You know, there's no safe dose of caffeine in little kids and even teenagers. In adults, they recommend a couple 100 milligrams up to 400, but there is no safe dose in children. So absolutely, they're much more sensitive to the effects.
For adults as well, we always have our cup of coffee in the morning. A lot of people do, I should say. I know we do.
Yes.
But for kids, we're finding that a lot of access. When should you start to scale back, or how, as a parent, can you scale back with your kids?
Well, these should be taken in much moderation. So limit it to, if they're going to have one, make it an infrequent occurrence. Certainly not multiple drinks a day, and probably not a daily occurrence either.
Okay, is there any other advice that you have for parents out there? I know we were just talking, your son, the prime drinks, and they're all marketed towards children, which is not really good, but access is just so easy.
I think the thing is to recognize, and if your child is intent on drinking them, recognize the signs of toxicity. If they're life-threatening, get them to the hospital. Okay. If it's mild, you can always call the Poison Center for advice.
Yeah, great advice, Dr. Banerjee. Thank you so much for that information, for being here this afternoon.
Thank you.